Hi everyone, welcome to my vlog, Puah-Midwife Services. How are you all doing? On today's topic, we're going to be looking at maternal mental health in pregnancy and postpartum period. Why this topic, some of you might say? Because there is no health without mental health. About 10% of pregnant women worldwide and 10% of women who've just given birth suffer from some sort of mental health disorder. These frequently go unnoticed and undetected, often leading to tragic and long-term consequences for both mother and baby. No one is immune from being affected with mental health disorder. You know, it doesn't matter your race, your class, no one is immune. It can affect anyone. Perinatal mood and anxiety disorder is very, very common. Symptoms can appear anytime during the pregnancy and even after birth. Postpartum blues affects about 80% of women. This is due to the hormonal imbalance in the body, and it fluctuates during the first couple of days after birth, 3 to 5 days after delivery. It actually subsides as the hormonal level stabilizes. You notice that you start to feel better, the woman starts to feel better. We have what we call PPD, which is postpartum depression. This is a major form of depression. It occurs following childbirth and affects about 10 to 20% of new mothers. Some of the contributing factors could include hormonal changes in the body, life stresses, trying to get used to having a newborn baby, not being able to cope, lack of sleep. And sometimes you could actually need some antidepressants to be able to stabilize this, and also getting counseling from a therapist who is used to issues with childbirth. We also have what we call post-traumatic stress disorder. This is a very severe form of depression. Usually occurs after a woman has experienced a very traumatic, witnessed a very traumatic event in her life or witnessed it. She is now a danger to herself and to others. Some of the symptoms could include intense fear, feeling helpless, horror, obsessive thoughts, panicking, feeling very numb, not being able to bond well with the baby, so feeling very detached, nightmares, sadness, anxiety. So this form is very severe and will definitely need treatment. We also have what we call PPP, which is a postpartum psychosis. Postpartum psychosis normally occurs about 2 to 3 weeks after delivery, and the onset of this form of mental health disorder is very quick and severe. So it happens just like that. Some of the symptoms could include delusions, hallucinations, lack of appetite, inability to cease, you can't stop, frantic energy, so constantly being on the go, extreme confusion, memory loss, paranoia, irrational behavior, and this treatment is very severe. Unfortunately, the woman will have to be hospitalized until stable, and she might need some antipsychotic medication and antidepressants as well. It's also important that women who actually have a previous history of depression prior to getting pregnant, or have been on medication prior to getting pregnant, and should also state this to the doctors in the history taken, because it might be that most of these women will definitely need to go back on medication post delivery. So it's very important to state your medical history. Our next topic is going to be support in pregnancy, birth and beyond. Continuous support has been known to make a difference in labor, birth and beyond. It helps with pain relief. It helps to make the woman feel more comfortable, for her to feel more reassured. 2017 Cochrane review of 26 studies had data from about 17 countries, and almost 15,000 women were recruited for this survey. And it actually showed that the women who had continuous support in the study gave birth spontaneously. So they're most likely to give birth spontaneously and less likely to use pain relief like epidural or needing any form of analgesia. And these women are less likely to end up with emergency situations like instrumental deliveries, your cesarean sections, and the babies are less likely to have low APGAR scores. So it's very important to have a very good support system in pregnancy and beyond. In October this year, the United Nations Health Agency surveyed a third of women in sub-Saharan Africa, women from low-income background, and 42% of 2,000 women experience physical and verbal abuse. Some experience non-consensual cesarean sections, episiotomies, and VBAC. And To me, this wouldn't have been the case if they had the right support system with them. Having someone who will be assertive, someone who's going to be able to provide intense physical support, but mentally and emotionally, it's very important. Some women would prefer to have their husband there, their mother there, an older relative or a friend. It's important to bear in mind the different roles that each of these individuals can play. You know, in an emergency situation, is the older relative going to be of good support to you at that time? Is your friend going to be of good support to you if your bed plan changes? So it's important to be aware of the different roles they could play. Encouraging your husband or partner to be more involved is of good use for you. Before birth, he can help around the house, doctor's appointments, antenatal classes, discussing your bed plan ahead of time. During labor, also, this bed partner, this is for the guys out there now, you have to be able to stay calm. Yeah, because you are actually supporting her right now. So being able to stay calm is one of the things you should master. Also, being able to offer positive encouragement. So saying the right words at the right time, not the wrong time. Breathing techniques, coping mechanisms, knowing your limits. It's also very important to know your limits. You're not a doctor, you're not an obstetrician. So knowing your limit, knowing when to draw the line. Also looking after yourself. The worst case scenario is having a woman who is laboring in pain and you have a partner on the sofa and the woman in pain is the one worrying about when last the partner had a meal. No, we don't want that in the labor room. So please, being able to look after yourself, have some snacks in the bag, have some coffee, whatever you might need, so our patients or our women don't have to worry about looking after you. Being ready to do some graft. Yes, we have some partners, some Burton partners who come in and they just get so comfy on the couch and that's it, they're gone deep in sleep. No, you actually have to be there with the woman, be there as her support, you know. And also attending antenatal classes will give you more experience, or you know, will help when it comes to labor, what to do in labor. The maternal mortality rate is on the increase, and we know most of these numbers, the highest numbers, come from sub-Saharan Africa due to lack of infrastructures and hospital facilities. But the alarming rate is actually in the Western world, is actually in the US. You have more deaths in the US occurring, and Black women are actually most likely to die from some of these life-threatening conditions in childbirth. Most women are scared of this, but all women are vulnerable to the same pregnancy-related health issues. Conditions that can lead to death could include postpartum hemorrhage, which is when the bleeding is more excessive after birth. And we have what we call preeclampsia, which is raised blood pressure in pregnancy or even after. And then we have sepsis, you know, an infection that we don't, of an unknown source, can lead to septic shock and septicemia. So knowing what symptoms that you have, what symptoms persist out of the norm. So if you're having headaches all the time and you don't know why you're having headaches, mention it to your midwife, mention it to the doctor next time you have an appointment. Don't even wait till your next appointment. It's better off to have it checked out. So if you have any symptoms that you're not sure of, mention it, your past medical history. I know some people don't have time in a doctor's appointment to actually tell them all about your medical history. It's important that we know what your past medical history is. If any symptoms persist, please have it checked out. Your safety is important to us and the safety of your baby. So on to my next vlog, guys. See you guys. If you have anything that you want me to talk about, any topic that you would like me to expatiate on, I will be more than happy to talk about it. So take care, guys, and see you soon. Bye.